Gut microbiome testing is one of the emerging toolkits that health practitioners use to examine patients who are suffering from gastrointestinal problems. Practitioner-only nutraceutical firm Designs for Health is one example that is providing a GI map test service to healthcare practitioners. Peter Barraquet, Managing Director of Designs for Health Australia, tells us more.
I might just start off with what the GI map is. It's a very comprehensive stool test that allows practitioners to see what's happening inside the gastrointestinal system of their patients. So the test focuses on the balance of your microbiome, and it's really ideal for those suffering from digestive complaints such as constipation or reflux or stomach aches, irritable bowel or inflamed bowel conditions. And look, the GI map test, has been growing sort of very steadily month on month since we launched it a couple of years ago.
The GI map test is developed by Diagnostic Solutions Laboratory in the US and uses the quantitative PCR test.
The GI map is it's a quantified PCR test, which is a little different to a standard PCR test. So a quantitative PCR technology, I guess, provides true quantitative values versus a standard PCR test that simply provides a positive, negative, whether you have something or you don't have something, and what the relative levels are. So really, this helps differentiate between trace levels, whether it exists or not, and elevated levels as to whether something that does exist is a problem or not. And that generally tends to indicate as to whether you have an active infection or an overall issue.
The GI map test is available to the public only upon healthcare practitioners' permission.
The trends are really positive. We estimate about 30% of natural healthcare practitioners in Australia use a similar test to the GI map. And I guess as far as the GI map test goes, the levels of uptake by practitioners are increasing on a month-to-month basis. So yes, it is available only to practitioners, but we think that's really important because a lot of these tests are very complicated and they really need an intervention by a practitioner to help explain results and all the information to the actual patient. And then that enables them to set up a treatment protocol, whether it's food-based or supplement-based or pharmaceutical-based or a combination of all of the above, to try and get the best health outcome for their patients.
Ask how health diagnostic tools can be better designed. Barraquet believes that the information could be made simpler to understand, with retesting easily conducted to help patients track for any improvements in their conditions.
One of the big things that we see and the feedback that we get from patients and practitioners is that there's a lot of tests out there that just provide a lot of information, a lot of unformatted information that's very hard to interpret. And I guess one of the advantages for something like the GI map is that it quite clearly segments the results and data into a series of different panels, so it's quite easy to interpret. So I would say that one of the biggest failings for a lot of diagnostic tests is that the information they provide is just too broad and too great, irrespective of whether it's accurate or not. It's just too much information. The other thing that I guess would encourage more consumer uptake is if they had the ability to do a lot of retests. So when you do the GI map, it's very comprehensive, and we think that there's the opportunity for the GI map to be cut up into different sections so that a lot of patients could go back after their treatment protocol and test again to see if the area of concern has been corrected, and hopefully that's at a much cheaper price and it's a lot easier.
In terms of pricing, the test currently costs $392 to $400 Australian dollars.
The GI map test in Australia currently costs around $380 to $400 Australian. That includes any sales tax of which there's none. That's been pretty constant over the last few years. It's probably cheaper in Australia than it is in other parts of the world, such as the USA and Canada. But much will depend on what government rebates and assistance there are. So it's not an overly cheap test, but it's at a fair price.